We've discussed this before, but we want to dig just a little bit deeper, knowing what an urgent care visit is going to entail. And I mean, most importantly, as a parent, when to go,
Oh,
right?
I always think about that with my kids. So joining us today is Dr. Mark Montano, Medical Director of CareNow Urgent Care. So tell us the basics about when to go to urgent care versus the emergency room.
Yeah, well, that's a really good question. We get that all the time. When should I go, and is it ER worthy or is it urgent care worthy? So the first thing I do is I say, if it's life-threatening, that's the emergency department. Things like chest pain, true shortness of breath, uncontrollable bleeding, stroke-like symptoms, those definitely need to go to the ER. But the vast majority of conditions we can take care of. Minor injuries, broken bones that aren't protruding, sprains and strains. We definitely see a lot of cough, congestion, runny nose. And then there are other things we do too, sports physicals, pre-employment physicals. So there are other things that we do, not just related to injury and illness.
That's a good point. This was like 2 years ago. I sliced my finger open. I could see like the flesh on the inside. I still don't have finger in my thumb. Feeling in my thumb. Yeah. But I went to urgent care in that matter. I'm like, I feel like urgent care could handle this. And you guys sewed me up. I mean, there was a whole little surgery. I got an injection. It was very painful. But that was a lesson to me because I was in that situation, right? When to go. Any other clues that you can give us?
Well, I think a lot of times people feel like they need to be seen and their primary care may be too busy.
Yep.
That is really when we shine. And it's because your primary care is busy taking care of those chronic illnesses. And we're really set up for the things that get you down today. You wake up and you have a stomach ache, you're vomiting. Maybe a child, ran into something and has a headache. We're able to take care of them. And sometimes it's a matter of making sure they get to the right next step. So maybe they don't need to go to the ER, but we want somebody to follow up with a specialist, and we're really good at doing that.
So summer is basically here. Do you find during the summer that there's more injuries or things like that, illness, or no?
Yeah, well, urgent care definitely has a seasonality. In the winter, it's cough, cold, flu.
Right.
Now, not that we don't see that, but we actually see an increase in those weekend warrior injuries. We're going to see more sprains, strains, minor fractures, and so you definitely see more injuries. And it's kind of nice. It breaks up the illnesses that you get so busy with in the winter, and it gives us an opportunity to use some of those physical skills where we can sew and splint and do some of those things.
So do you guys do x-rays if I fall off my bike and like twist my ankle or something? I don't know if it's broken. Can you guys do an x-ray?
Oh, we definitely can. And we have plain film x-ray. For more advanced imaging, not that we can't see you, but we would send you somewhere for that, usually an outpatient imaging center.
All right, Dr. Montano, thank you so much. Appreciate you.
Well, thank you.